So the first question I have for you is, could you just tell me about when you were first diagnosed with tuberculosis?
Somewhere in September 2013. We have called me some we got your file, we think you were positive TB.
Over the course, we have a 6-week block, and we brought in someone with different respiratory disease each time, because people complain of shortness of breath, which is the most common complaint we see in lung clinic, but it can be from different causes. Some from tuberculosis, some people from smoking related, some from occupational medicine, some from people with pulmonary hypertension. So it's all different. So they have to know what symptoms and what questions to ask that discriminates him with tuberculosis from someone else with emphysema. And they're not the same. And as physicians, they need to get to the level that they can ask the right questions, look at the right information, and from there, draw the right conclusions so they can treat people correctly.
Okay, do you have any other active medical problems, any heart problems, any lung problems?
No. What do you, when you say medical problem? Medical action not
Anything you've been diagnosed with? Have you been diagnosed with anything?
Besides that, I have my high blood pressure.
Okay.
I have diabetes.
Okay.
Also, I have arthritis. So something that I never had before. When I'm young, I don't care. When you reach 70, I'm 74 years old now.
It's unscripted, so we don't know the answers and they don't know the answers, and sometimes some of the patients are not happy with medicine, sometimes they are, and it's good that the students get a chance to see why they think some physicians treated them well and why they think some physicians treated them poorly, and then from that hopefully move forward, not only with medical knowledge but the ability to decide in many ways which physician they want to become.
Things like this morning, getting to talk with the patient really helps us, especially this first year. We learn about all these disease processes, and it's really a treat to get to see what they look like in a real patient. And being able to talk to them and hear their story and hear how it really affects their life is really beneficial for us. So yeah, when the 3rd and 4th year come along, we get to spend a lot more time with these patients in the hospital. It's definitely going to give us a leg up and feeling comfortable in those kind of situations and being able to treat them the best that we can.
Hi, Mr. Shine. My name is Parker Mullen. I'd like to go over some risk factors for TB. Did you ever have a family member with tuberculosis?
In Cambodia, there's no way to know anybody have TB or not TB.
Student, it means people who still learning. So I think it's important to them because they learn something from me, because nobody knows what they will get or what their client will get until you know something, especially experience from people who already know what it TB do to you and how to get rid of TB. So that their experience, I think, that important.
So what we expect from them is these groups work and they bring their different expertise in how to write and how to interpret data, and some know different stuff than everyone else. So as a group they have to work together. So I think it's a way to, we give them an hour and a half now to try to sort all this information, write it into a document, and then they get together during the course of a week and integrate it and write it up. So I think that's the biggest thing, how to work in teams and then how to do their own work. So we don't tell them what to give us, we give them guidelines, but the final result is theirs. So for us it's interesting because we get to see how the different groups think and how they, what topics they find interesting, what aspects. So we learn a lot about how well we're teaching them by what they give back to us. I think it's just the opportunity for them all to be in one room, not in a sort of a tiered lecture center, but just in this room. They can be around the patient and hear him and see, see what he's saying, see what he's talking about, and be able to interact in a group. The computers help too, because now they go back and they look at the data, they look at the x-rays. So it's going from this patient, what they've heard, to things that they'll see. So they see an x-ray for someone who's got tuberculosis in this case and what the lab values look like, to give them the experience to learn how to talk to patients and interview them in a sort of a formatted way about different diseases and within respiratory medicine, obstructive lung disease, restricted disease, and infections. So it gives them a chance to ask questions and identify the medications people are on, how the disease impacts them. In a lot of ways, it's sort of a part of the humanism part of medicine to see what the impact of chronic lung disease is on people in terms of what the cost to them financially and emotionally and within their families.
Thank you
okay?
so much.
You're looking good.
Thank you, sir. It was a pleasure and an honor.
Thank you.
Yeah, thank you. We're very lucky
All right,
to
thank
have
you.
you. Thank you.
Thank you, sir.
Yeah.